Alright, what's going on, guys? Noah's just checking in another video regarding testosterone replacement therapy. Today we are going over blood work yet again. This is the first time we're checking in on my blood work results since I lowered my dose from 200 milligrams a week of testosterone cypionate to 180. So I've been on 180 for 4 months, 180 per week. I do 2 shots a week, so that's dividing the 180 in 2. And last time my results were indicative of needing to lower. Now we went ahead and lowered, and we're going to see what they are. I felt like they would be much lower, than they being my estrogen, my E2, my testosterone, total and both free. But the results were rather interesting. I have with me here today, again, Dr. Erica Zelfan. Be as gracious and kind as you can be in the comments, because your feedback and response sort of helps nudge her in terms of me pressuring her to come back on the channel in the future. So we're really grateful to have you on the channel, and I look forward to going over the results. Again, these are my first blood work. This is my first round of blood work since lowering the dose. And take it away, dear doctor.
All right. So looking at this screen here, we've got 2 columns. This column here tells us where you were in March when we last measured your lab work.
Right.
And then this column here is June. These are both 2015. So this is just after a few months of what we did 2 things, as you already said. 1 is we lowered your testosterone dose, and 2 is we actually put you on a little bit of thyroid replacement hormone.
That's right. I apologize, guys. We also started me on levothyroxine, which is a T4 medication to help nurture my T3, which is the most important marker for thyroid, correct?
Yeah, so as your body needs the T3, it just takes that T4 and it turns it into the T3. And we'll see with your labs that your body's doing that beautifully.
Okay, cool.
Yeah. So, and you've been exercising.
Hell yeah.
And you've been keeping up the amazing work with your diet.
Much better work. Very, very
right?
much
So
improved.
that's really clear here when we look at your cholesterol panel. So we're still, yellow means borderline. We're still borderline on a number of things, but we have come down. So total used to be 214, now it's 202.
Okay.
LDL, you were in the red there.
Now we're in the
Yeah,
yellow.
this is great.
That's good.
I'm really amazed by your triglycerides, which are the cholesterol that comes from sugar. You just like flipped the numbers. From 75, you went to 57.
Yeah, that's really awesome. I cut out added sugar from my diet. It made a big difference, like we would have expected it would. So.
Yep. So, and then the little numbers on the paper got the memo that you changed your diet.
Yep.
And they cooperated.
Perfect.
So same thing goes for your lipid ratios of your good to bad cholesterol are looking pretty good there. We didn't repeat the diabetes test because we're pretty sure you don't have that.
Right, that looked good last time.
And then looking over here at your sex hormones, OMG. All right, so your testosterone was 914 when we ran it in March, which is high.
Right.
It's 1265 now. So,
say that again. Say that again.
Okay,
Just
so
listen carefully, my friends. This is the part that
doesn't make sense.
yeah, just it confused the shit out of me. It really did. So
Yeah.
So say that again.
So in March, on 200 milligrams of testosterone a week, your level was 914
On my trough day.
on your trough day. Then we lowered your dose
By 10%.
by 10%, but your level went up
By like what, 20%?
by, I can't do math on camera. Significant
It went
amount.
up significantly. The
It
only
went
thing,
up a significant amount. Look, 30%.
30%, there you go.
Yeah.
I will add that we did draw my blood 1 day sooner based on
That's
scheduling
true.
conflicts, so we will throw that out there. However, we both agree, and it's mostly your opinion that matters, that wouldn't change the fact that that's an extremely high
That's
number.
really high.
That means I'm
No.
staying in the thousands 24/7. I'm
Right.
never coming down, basically, right?
Basically, especially since, if 2 days after we drew this blood, you're doing another dose.
Right.
After the day you take your dose, you're probably more like 1,500.
Right.
So you're probably getting mega dosed at some point.
Got that Captain
So-
America action going on right there. Chris Evans, what's up? Sorry.
So, what I think part of what's going on here is maybe we didn't get an entirely accurate read
Maybe so.
because you're a fellow who does doses twice a week.
Right.
As opposed to, most guys who are doing TRT, they're doing once a week, if not once every 2 weeks, their injections. So
Right.
I'm not entirely convinced that we have a true trough on you.
Okay.
But that being said, since we are doing twice a week dosing, that's how you feel the best, then we should pay attention to those numbers. And these numbers are telling me that we need to go down.
We need to go down. So that is the biggest, most important message of this video is that I lowered my dose, and of course you can correct me if I'm wrong, but please don't interrupt me. Don't ever interrupt me.
Okay, I won't interrupt you.
I should start talking. Yeah. That was a joke. That was sarcasm. We lowered my dose, and my testosterone went up. You know, I'm still scratching my head about that. I think my lifestyle also went up in a matter of speaking, but my total went up, you know, significantly, and that astounds me. So I couldn't feel more confident lowering my dose yet again, because it's like, this is, I suppose, for a guy on TRT, especially one who you could only like theorize why I started, this is about like a best case scenario for mood and sense of well-being, to be doing well, numbers be going up while lowering the dose. It's pretty exciting is what I'm trying to say. Let's go on to free testosterone.
Yeah, you're free, so that went up as well. So you were at 249 in March.
Which was tippy top of that.
Yeah.
Like, that's like blown over the range too.
That was high. And we are, oh my gosh, we're at 379. So, you know, at this point, it's either talking about just doing once a week dosing, or just lowering your dose, or both. When you and I discussed it before the camera came on, it sounded like you wanted to keep going with the twice a week, but we're just going to lower.
Yeah, exactly. I feel more comfortable that way. We're going to lower me from, well, Doc's going to lower me from 180 to 160. So that would be 0.4 mLs every 3 days on one and 4 days on the other, based on my work schedule and when I choose to get those injections done. So now we're total down 40 milligrams per week from where I'd been for like almost 3 years, guys. So this is the most drastic change I've had in my treatment in a really long time. And I think this also goes to show that more does not always mean better. I mean, if you take more than you really need, you're sort of setting yourself up for potential side effects, unwanted aspects of being on TRT, and certainly it affects other hormones more.
Oh yeah. Yeah, and your testosterone receptors, after a while your body starts down-regulating them when you've got too much testosterone there. So sometimes less is more.
Okay. Let's go to my favorite stat.
Your estrogen? Or? So the estrogen, your estradiol actually went down. So that is probably directly related to you actually taking less in the dose. Because anytime you take testosterone, it's going to turn into estrogen by way of that enzyme called aromatase. So we're just giving the aromatase less to aromatize. So now your estrogen levels are actually normal.
So I lowered my dose, my T went up, my estrogen went down, and my mood went up. And I could be in my head about this, but I feel like it's possible. Here's a curveball. No pun intended, that my testicles have retained just a smidgen of size.
Oh, okay.
And I hadn't talked to you about that, but the missus slightly noticed.
Cool.
And I was like, no way. And then I sort of started paying attention to my downstairs mix-up, and I felt like that might be the case. Now, whether that's in my head or not, I don't know. But I thought that was interesting, because I did have some atrophy on 200 milligrams, and I think in general, the longer I've been on 200, the more atrophy I was getting over the years, as opposed to like the first 6 months. So it's like increasingly decreasing. Anyway.
Yeah.
So,
well, anyways, added bonus. So glad to hear that.
Yeah, I'm sure you're thrilled. Thrilled to hear that.
You know, that's a sign of normal physiology.
I know, right?
You know, how old are you?
28.
You're not supposed to have atrophied testicles.
I know. I'm supposed to have very supple, plump balls.
That's right.
That's right.
So I'm glad to hear that there's been a shift in that direction. And we should change the subject.
We should, yeah. Let's move right on. Is there anything else important that we need to talk about real quick?
Yeah, I do want to make a note here on your thyroid rather. So back in March, your TSH was 4.83. That is way too high. That means that your brain was screaming at your thyroid, going, what are you doing? I need you to work harder. You're not making enough hormone here.
Okay.
So after we put you on 50 micrograms of the T4, your TSH is now 3.25. Most docs would consider that to be in the normal range. Us functional medicine doctors, we like to see it more between the levels of 1 and 2.
Why is that?
It just tells me that your brain is as happy as it can be with the amount of thyroid hormone that's floating around in your blood. Okay.
So again, just to reiterate, they started me on a thyroid medication because I was looking a bit hypothyroidism, like she just said, and now my TSH, one of those indicators that tells you your brain's screaming, as she said, for your thyroid to produce more T4, which turns into T3, right?
Yeah.
So she started me on levothyroxine. This looks much more improved. I have no doubt that this could have been part of the reason perhaps mood's been a bit better. Is it possible?
Could be.
Could be. At least
Absolutely.
it's something to think about. So
Absolutely.
I'm really glad. And I've had no side effects, by the way, none negative anyway that I could notice on the level of thyroxine. She told me to look out for a possible increase in heart rate or a little bit of anxiety, maybe some restlessness in terms of trying to sleep.
Yep.
And I've had none of those, for whatever that's worth.
Yep. Yep. So, looking at your levels of the thyroid itself, the T4, total T4, free T4, total T3, free T3, free T3,
Free tea free.
free T3.
Free tea free.
These are telling me that you're in the normal range on those things, but you've got room in that range to go up.
Awesome.
Also. So based on this, based on how you've been feeling, I actually would recommend that we bump up your levothyroxine dose just a little bit.
Right, so he took me to 75 micrograms.
Yeah.
From 50. Is it possible we'll stay here?
It's possible we'll stay here.
We'll look at it for the next round of blood work. And what you're thinking in bumping it up, is it just so that my TSH goes down just a sliver more into that 1 to 2 range?
Yeah, I just find that people feel better when their TSH is in that 1 to 2 range.
Okay, so I think that's really key. Let's not miss what she just said. She thinks and she feels, based on her schooling and clinical experience, that people feel better when their TSH is between, you said, 1 and 2. And so a small little pearl of wisdom, if you will, something to keep an eye on when, especially for the guys that are on TRT, keep an eye on your TSH. You know, don't let that wander off too high and then blame necessarily everything you might be feeling or not feeling on your testosterone. Just something else to keep an eye on.
Yeah, and I do see that a lot when I inherit patients from other doctors and the patients are on TRT and nobody's looked at their thyroid.
And no one's looked at their thyroid. You have to, I mean, that's something I've definitely learned more with you than anyone else because I haven't had someone pay such close attention, but understanding the implications of your testosterone is huge. It's really genuinely important, so.
Absolutely. So other than that, it looks great. Your cholesterol's shifting in the right direction. Your vitamin D looks good. Metabolic panel looks good. This creatinine is still high, but we talked about that last time. It's probably because you lift weights.
Right.
So it's just a little bit of that muscle breakdown that we're picking up there.
But it's a little bit lower, even though it's very slightly decreased. It looks a little bit lower.
Yeah. So
this is a successful experiment, if you will.
I'm feeling really good about it.
Me too.
About your lab results and about the plan at this point. I mean, you'll tell us how it goes.
Yeah, I definitely will. So, anyway, guys, that is the blood work update. I hope you enjoyed it. I hope you appreciated Dr. Zelfan coming on. I seriously appreciate you. Let's stay classy, San Diego. Again, when we share this information, I think this is a good disclaimer. We're going over my blood work specific to me. She's not here to treat, diagnose, or advise you guys. So please just take this as an informative video. And be sure to consult with your own physician before doing, changing, or making any sort of regiment changes in your own testosterone replacement therapy. But otherwise, thank you so much for watching. The outlook is good. And we'll check in if she feels like she's capable and wanting to. We'll check in again when we do blood work in 3 months. Thank you so much for your time. Be sweet in the comments below. Thank you for your time.
Thanks, Noah.
And we'll see you guys in the next video. Peace.